Now, last week, the SABC reported a new and ghastly trend amongst drug addicts. One spoke to us saying his group was injecting sanitizers. Addiction, substance abuse and domestic violence linked to all the concerns during the current lockdown. And then for those who can't get alcohol and cigarettes, there may be withdrawal symptoms as well. To discuss, we're now joined by Thembekile Msane, spokesperson for the South African National Council on Alcoholism and Drug Dependence, SANCA. Thembekile, thank you so much for being with us. SANCA, firstly, has said that there's a gap between policy and intervention, which can be seen in the prohibition of the sale of alcohol and nicotine. Can you just explain what you're saying there, firstly?
Good evening, Francis, and thank you for having me. Yes, when we're talking about the gap, we're talking about specific things like what's happening right now, whereby we see most of the patients and the clients, our service users rather, that they're experiencing a huge challenge to face COVID-19 during this period. So one of the main things that we were actually looking at is how do we actually begin to put these policies into place. For example, if we're saying yes, there's a ban, and then people will not actually be able to get alcohol or cigarettes, what needs to happen? So most of what we've been advocating during this period is to ensure that actually people can utilize each and every helpline that is out there, and also looking forward to actually helping them to receive counseling during this period, because we do understand that being on lockdown in homes is actually one of the main challenging things.
Yeah. Well, what does SANCA, what's your opinion on the ban of cigarette sales? It is hard to tell an addict to suddenly stop something.
Our take is, right now is the fact that it is an unforeseen situation right now in our country. We acknowledge the fact that we need to recognize the pandemic that we are currently facing. We have also received positive feedbacks from some of our service users saying this period has actually given them the opportunity to change and actually change their lifestyle. On the other hand, we're always also going to receive people that also will fight against it. So from our side, we are seeing, both sides of the coin, to say it is positive as well as some people are saying it's negative. But we are absolutely 100% with the president to say the alcohol ban, it needs to remain. We have seen, a lesser amount of crime that has been taking place in our country. Hospitals also have reported that, in terms of drinking and driving and also, assault cases, they've also been reduced. On the other hand, as addiction recovery centers, they have received high volume and influx, of WhatsApp SMSs, phone calls of people going through withdrawals. And what we've actually said is please make sure that if you are experiencing any of the withdrawals from stomach pains, from headaches, from sweating, please consult a nearby clinic or one of the hotlines, or consult, a professional healthcare provider to assist you.
Well, this is so important because for some people, the ban on alcohol, let's stick there, will be inconvenient. If, like me, they like a glass of wine. But for others, it will feel catastrophic. How many sort of alcoholics do we have across this country that are in a precarious mental situation right now, as you say?
Right now, I don't have specific stats, but what I can say, the World Health Organization has named South Africa the 9th country that actually struggles from substance use disorder. So this indicates that this is not something that just started, recently. We've been having this problem in our country for years, where we are experiencing amount of people drinking alcohol or using any illegal or illicit drugs. So when we're actually looking at the fact that this is something that people are struggling with, we also need to look at what actually is the positive side of it. Because I think currently we are focusing on things that are only about, what is the challenge. Let's also look at how can we actually deal with this challenge. How does one come out of this challenge that, it happened overnight, to say from now on there'll be no alcohol, there'll be no drugs, or there'll be no cigarettes for you. So what do we do? And I think that's the main question that we've been posed with, currently. And that's the main thing that we say, let's start to actually deal with this challenge.
And I think one of the things concerning you is that domestic violence is not going away, and people experiencing withdrawal in a confined space with family members not allowed to go out. What are the implications of that?
Yes, indeed, we do acknowledge that gender-based violence has increased. And, together with the government and the various departments from health and social development, including us as SANCA, we have set up, branches around South Africa for people to utilize the hotlines that are available for counseling to assist that if a family member is going through withdrawals or they're becoming violent, what do you do, So there is actually help out there that people need to please make use of. Our hotlines are available. They can check out our Facebook pages and all social media houses to actually get information and receive that information to know what actually to do with the person that you're struggling with. Because one thing that we always say, let us not aggravate, someone who's actually violent or someone who's actually struggling with substance use disorder. Remain calm and actually be careful that, you don't actually want to make the situation even worse than it is. But what's important is we need people to speak up and not just sit at home with a situation that is becoming violent or that is toxic. We need people to actually start taking the calls. Some of the toll-free numbers are actually free, so we need people to actually voice out.
Yeah. Thembekile, it sounds like you're supportive of the liquor ban, maybe not sure on the cigarette sale ban, but are you concerned that there will be a black market that potentially unhealthy, let's put it that way, liquor and cigarettes that are even worse for your health are on the market right now?
Absolutely. That is something that we are anticipating, that there is people who will definitely go into the black market due to the nicotine ban as well as the alcohol. We are aware, and most of our clinics are actually prepared right now to put measures in place to say if ever we are experiencing, this high volume of people then with different kinds of symptoms or new drugs that they can actually implement, because we've seen that previously, that there's always new drugs coming up, now and then. People are becoming creative. So we are aware that this can be a situation that we are currently facing, and we are actually preparing ourselves to deal and handle those situations as they come into our doors.
Yeah. Are there any new trends? I mean, we had an alarming story last week about people using sanitizer, injecting sanitizer into their blood. Sanitizer is hard to come by for some, but there is more being made and distributed.
We've heard that. However, I would like to say with some of our SANCA clinics, we have not yet experienced any service user who come through our doors injecting sanitizers. We have read about it, we have heard about it, and we have consulted with our medical team to actually just maybe give out more information of the danger of one actually taking, a sanitizer or injecting sanitizer and the side effects of it and how harmful it can be. So we are also, alert about that to say what can we actually start to do. So there are forms of interventions online to educate people, and we are bringing awareness through social media and through, our centers and clinics that are already opened and standing by to assist at any way possible.
All right, thank you very much, Thembekile Msane, spokesperson for the South African National Council on Alcoholism and Drug Dependence.